Department of Pharmacology, AIIMS, New Delhi. A very warm welcome to you, sir. Inviting our distinguished chair, Dr. Khalid bin Ibrahim, Director, Selangor State Health Department, Malaysia. A very warm welcome to you, sir. Inviting Dr. Mushtaq Ahmed, former Director, Central Research Institute of Unani Medicine, Hyderabad. Warm welcome to you. Inviting Dr. N. Zahir Ahmed, in charge Regional Research Institute of Unani Medicine, Chennai. Also inviting our eminent speakers now, Dr. Gayatri Vyas Mahindru, Director, National Accreditation Board for Hospitals and Healthcare Providers, New Delhi. A very warm welcome. Inviting our eminent speaker, Dr. Jugal Kishore, Head of Department, Community Medicine, Safdarjung Hospital, New Delhi, and our eminent speaker, Dr. S.M. Arif Zaidi, Department of Jarahat, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. A warm welcome to you. So, ladies and gentlemen, the topic for this scientific session 3 is Achieving Sustainable Development Goal, SDG 3. Time duration is 1 hour. And each presentation by all our eminent speakers is for 15 minutes only. And may I hand over to Professor Surendra Singh to carry forward.
Thank you very much, and good morning again. I welcome all the speakers and my co-chairpersons for this session. The Achieving Sustainable Development Goal, SDG 3. And since time is very restricted one, so I straight go to Sir S.M. Arif Zaidi, who is a former Dean and MS of Jamia Hamdard and Majidia Hospital. And he will be talking about the successful Unani intervention in case of Barger disease. Though it is a clinical study, it might take time, but I request please conclude in a limited time. Thank you very much.
Thank you very much. I have taken this topic, though it is a very rare disease. Basically, I am clinicians. But when this disease appears, Barger disease is problematic too. That's why I have chosen to talk about this one. Barger disease is basically a disease of mids and small size of arteries in which there is a thrombus formation has taken place along with the inflammation to the arteries, and consequence of that there is a occlusion in the arteries, so that the obstruction of blood vessels in the limbs reduces the availability of blood to the tissues, resulting pain and damage or destroy to the tissues. It often leads to skin ulcerations and gangrene of fingers and toes also, which become problematic and never heals. This is a picture of Barger disease for introduction, just first-hand introductions. And although, as I said earlier, that it is a rare disease and only 6 out of every 10,000 people affected this, and this is the age in between the ages of 20 and 40 years of age, although the persons around the age of 50s may be involved. And only seen in the smokers and the tobacco users as you see, and it is rare in females. This is still very uncommon in children. However, in some children who are having autoimmune problems may be the victim of this disease. There are a number of risk factors. The foremost one, some hormonal influence, some genetic factors also, those who are sensitive to the cigarettes, those who are having altered autoimmune functions, those who are having lower socioeconomic groups, and recurrent minor injuries and poor hygiene may be one of the reasons for development of this problem. You see that, as I told you earlier, because of the smoke, the carbon monoxide goes inside along with the nicotine, resulting vasospasm of the vessels and hyperplasia, resulting thrombosis of the vessels and obliterations, therefore, and segmental pen arteritis has taken place. It is segmental pen arteritis. Artery, veins and nerves are together involved. Nerves involvement due to blockage of vasa nervosa, the network of the vessels, causes rest pain also. Artery involvement leads to features like claudication pains. There is the intermittent pain, severe pain with blockage, plenty of collaterals nerves to compensate that. And that collaterals maintain the blood supply to the ischemic area. This is known as compensatory peripheral vascular disease. This is the, you see, Doppler of that stone. The normal Doppler where you can see the two arteries are taking blood together, and on the second picture you can see when there is a segmental this occlusion of the blood, there is compensatory vessel supplying blood to the poor areas also. In this picture also you can see the first one is the normal one, and the second one is the in which there is a obstruction to the vessels and the blood is not going there, so that there is a pain. And this, there may be a certain complications in consequence of that, as I told you that the blood supply became stopped or minimal, so, and arterial lumen is blocked because, but not thickened like in case of atherosclerosis. You see that in the cases of Berger disease, atherosclerosis is not a, you see, the thing which create problem, but it is on the inflammation to the vessels that create the problem. In 10% case it may be bilateral, and 10% females may be the sufferer of that, and in a few cases it may happen in the upper limbs also. This is the Shinoya criteria. I will not go in the details to go through that, what is the criteria of that, because I have been restricted to take limited time, so that I am running in hurry. These are the clinical features, as I told you, common in smokers, intermittent claudications, pain in foot and calf muscles. There is recurrent migratory superficial thrombophlebitis and rest pain also. Maybe ulceration and gangrene. And if you examine your patient, the pulses maybe the pulses of dorsalis tibialis, dorsalis pedis, posterior tibialis, popliteal pulses may be absent or may be feeble in such type of cases. This is, you see that this has been shown through the arrow, the segmental, you see, blockage in the vessel, so that the blood is not reaching that, and therefore there is claudications, there is pain up in consequence of that. And I am skipping this slide also. This slide I am also skipping. Prognosis, symptoms of Berger disease may disappear if tobacco use stop. You see, the patient may have the choice, either the patient has to continue with the smoking or to retain his or her foot, so that one thing he has chosen, so that the smoking has to be stopped immediately. This is the case of Berger disease, and the patient was suffering from Berger in both feet and the severe pain, so that the patient was on painkiller injections. You see, in the cases of Berger disease, patient cannot walk even for few meters, so that when the patient walks, patient has to stop a little while, and again he is supposed to walk again. This is the situation, and thereafter when the disease becomes, you see, severe, there is pain even in the rest also, and there is serious. So that this patient was on painkiller injection and admitted in our hospital. I put this patient on oral medication beside this local dressings and exercises, beside leech therapy also. And this picture taken after completion of 2 weeks. It is difficult to say everything in that short time. You see, this picture was taken after 1.5 months. Here you see there is a sign of, you see, healing seen in the wound of this person. And this is the another case. Though in this case the patient was not, you see, was not able to retain the smoking, and he was continuing that thing, I came to know, and thereafter the patient was discharged. And ultimately both foot amputated in Apollo hospitals in this case, just because of not smoking this cigarettes also. This is another patient suffering with the same disease. Here you can see the toe is necrosed fully, admitted and put on oral medications beside the leech therapy, exercises and daily dressing to remove the slough and for the healing purposes also. This is you see the toe of the same patient, and you can see it was at the verge of amputation. So the treatment was continued, and this picture was taken after 6 weeks. Here you can see the sign of healing all there. Ground tissue formation has taken place. Pain has also come down, and sign of healing are there. This is another patient you see came from Radhabad, suffering from the same problem in the right toe, having severe pain in the toe, cannot walk because of that, and again admitted, put on the same medications, and this picture was taken after completion of 4 weeks. Here you can see the signs of healing in this picture also, and this picture was taken after completion of 8 weeks, which further show the sign of healings. And this picture taken after completion of 10 weeks, and this is after 12 weeks. Now patient is fully all right and on walk, there is no pain, patient can walk up to any extent. This is the other patient which was having pain even during rest also. He was kept on the same treatment, and after the completion of 2 weeks, that pain has gone off, and only with the burning in the soles patient is having. Nothing else, patient is still admitted in the hospitals. This is the other patient having the same problem. This is one of the, you see, reported aircraft pilot of the aircraft this thing, and has suffered this problem, and he was admitted to Vedanta hospital, and where he was advised to go for amputation. And searching that for alternative therapy, he led that to people. He was not able to walk even for a few meters also. And so that patient were continuously remain with us in the hospital, and kept on the same oral medications, exercises, massage, and debridement was done as and when required in this patient. And this picture was taken after completion of 1 month, where you can see the sign of improvements in these pictures also. This picture taken after completion of 2 months, and this picture taken after 2.5 months. And this picture taken after 3 months. Here you can see the foot becomes all right, only a small portion became self-amputated in this, but patient on walk now. And even though patient has done trekking and walk around 8 kilometers without having any pain, he is completely alert and join his services again.
Try to conclude, sir.
Okay, sir, thank you. Just a minute. So this is the prevention regarding that tobacco smoking, and this one care of the limbs, how to do the care of the limbs. This is the exposure of the feet from cold and warm temperatures to be avoided. Pressure, sudden injury, any dryness, and any ill footwear, so many things may be. And again, this is the percher position exercise which you may see through that internet somewhere. Nothing. Thank you so much. Thank you.
Thank you, Dr. Arif Zaidi. Thank you very much. I take this opportunity to thank all my...
Mehtab Ali. And to Dr. S.M. Arif Zaidi. And may I request Dr. Ghazala Javed to kindly do the honors of presenting a token of gratitude to our distinguished chair, Professor Surendra Singh.